And hello everyone, my name's Aimee. I'm here with Hayley, as Colin said. Thank you so much for having us. And yes, we'll be talking to you about the movement towards digital healthcare that we're seeing currently. So just as a quick overview of what we'll be covering today, we'll be talking about what we mean by digital healthcare, some of the pros and cons about using digital technology in healthcare, some examples of where digital healthcare is being used currently, and then some future uses and future research. So this is kind of the image that I got when I typed in digital healthcare with the view to kind of setting up this webinar. So it looks very futuristic, it looks very matrixy, which is completely opposite to what I see as digital healthcare technology. Digital health technology should be all about moving the power of controlling health back to the patient and back to the service user. So we shouldn't be focusing on all the kind of the techie medically bits. It's all about kind of how people can use technologies to support their health and well-being. So these are some examples that I pulled out when thinking about what digital healthcare means. And in a nutshell, it's anything that is electronic or digital by nature that we can utilise to improve health and well-being for either the individual or population level health. That's what it is. It's quite easy. And many of these tools and technologies we're already using. You know, you'll see them in everyday use. So things like smartwatches, smartphones, social media, video calls, telehealth care, online support groups, and then perhaps onto things which are a little bit less common, things like wearable sensors, virtual reality and augmented reality. And I'll go over some of these in a little bit more detail later. But before we do that, we'll just go on to some of the pros and cons of using technology in health. So one of the pros, a big one, is that you know, digital technology can often be used anytime and anywhere, which makes it much more usable for patients and service users. You know, we're not then confined to times which healthcare professionals are available or when services are open. You know, we can use it when we want, wherever we want. It also has the benefit of reducing travel needs, which has the, you know, the benefit to the environment, but also reduces increases the accessibility of services for people who perhaps don't have access to transport or live more rurally. It can also, it's often also cheaper. You know, it's a real cost saving a lot of the time. People tend to think of technology as being quite expensive, but actually it's people that are expensive. You know, it's healthcare staff which cost the pennies. So it's really good where you know, budgets are being really tightened, and it has the potential to be able to reach more people than, you know, one-on-one face-to-face care, which obviously makes it more efficient and you know, ties into the whole budgeting needs. And it's, you know, it puts the power back into your hands as a patient or a service user. You know, you have the ability to manage and steer your own health rather than relying on services or health professionals. And it also has the potential to reduce bias. So healthcare professionals, like any other human being, are prone to unconscious bias. So if you look in the realm of pain medication, unconsciously people are less likely to prescribe pain medication to women over men, or people from ethnic minorities over people from white backgrounds, and using things like artificial intelligence and machine learning in the diagnostic level can kind of reduce some of those biases. So there's lots of potential for it to do real good. But there's also some areas that we quite rightly should have concerns about. So firstly, technology can be really challenging for some people to use, either because it's not user-friendly or because people don't have the digital literacy to be able to use things effectively. And that's not just the patients and the service users, sometimes that's for healthcare staff as well. And what we see in a lot of research is that actually the patients and the service users are really keen to embrace new technologies in healthcare. And it's the staff that are perhaps a little bit more, resistant and cautious about integrating these into services. Then we have concerns about privacy and information security. So with the rise of electronic health records, it's obviously really helpful in terms of being able to pass patient information safely and securely. But equally, there's concerns around, well, who has access to that information? What are they using it for? When there's some kind of health monitoring going on, people have concerns, okay, well, who's watching me? Who's looking at this information? And quite rightly, we should be concerned about who has access to that data. Then there is the concern about, AI and robotics perhaps replacing human contact, and quite rightly, people are concerned about that. What we actually see, and I'll give you some examples later on, is that sometimes the opposite is true. The integration of AI and robotics actually increases human contact where it's needed. And then there's the whole issue around efficiency and accuracy and efficacy. So all of those concerns around, are these technologies doing what they're supposed to be doing? Are they measuring things accurately, over and above what a human or face-to-face intervention might provide? So some real pros, but some real cons that you'll see us working through, I suppose, over the next few years. So where is digital tech used in healthcare? Well, in a nutshell, it's everywhere, in all aspects of health and all areas. So some of you might be familiar with this little icon here. So this is the health triangle. And it's basically just brings to the forefront that, health isn't just about physical health. It's about mental and emotional well-being, as well as social well-being. And when you are looking at chronic illnesses or conditions such as brain injury, it's really important to ensure that all of these aspects are being taken care of. And digital healthcare can really help support that. So moving on to some examples of digital healthcare now. We'll start with wearable sensors and trackers. So some of you might already use things like smartwatches and Fitbits to measure activity. These can be really helpful in improving activity levels or monitoring activity levels, and perhaps just pacing yourself to increase that slowly over time. Perhaps if you've had a prolonged period of inactivity, they can be really helpful at kind of pacing yourself. Then perhaps a bit less familiar would be the eye tracking and eyeglass technology, which has the potential to be useful in object and facial recognition. So if there is brain damage to the part of the brain which controls recognition of faces, these could be really helpful interventions in the future. Then there's things like body sensors. This is being used in diabetes care particularly. So a little sticky thing that you put on you constantly, and it will send readings either to a phone or remotely to a healthcare practitioner to keep that kind of consistent monitoring that perhaps doesn't involve periodic measurements or injections or, you know, blood taking, that kind of thing. Then in terms of smart clothing, so these have the potential to measure all of kind of the vital signs that healthcare practitioners are, you know, use as kind of key indicators of health, but also things like wayfinding technology. So I heard recently about a study where they're looking at using haptics. So, you know, on your phone where you get a little buzz when a notification comes through or something, it's used to help people to find their way around. So if perhaps you have struggles with memory or wayfinding, or, you know, locating where you are, these could be really helpful in helping people to, you know, find their way home after a walk or something like that. And then perhaps a bit less so to do with health, but tracker technology. Again, if there's kind of memory issues and you're constantly losing things or forgetting things, tracker technology can be useful for locating lost items. I use these myself. They're really helpful. They're moving on to smartphone tools and apps. You know, the majority of the, you know, population has a smartphone now, or access to a smartphone. Which makes them really accessible, and, you know, we can use them on the go as we go. Many of them have inbuilt apps such as reminders, planners, diaries, which can be useful in, you know, planning time for activity. We all know if we plan in the activity and have it there written down, we're much more likely to do it than if it's, you know, just a thought in our head. Reminders for things like medication and alerts, that kind of thing. And it can be really useful for actually planning out your day in terms of like pacing yourself and managing fatigue. Then we come to the more specialist apps, so things like diet records, meditation apps, medication apps, sleep apps. You know, if there's some aspect of health that you want support with, more likely than not, there's going to be an app out there which could help you in some way. One caveat to note, though, is that there's not a lot of regulation at the moment around health apps. You know, Apple and Google and Samsung, you know, in their app stores, they tend to look at how information is being used, but less so on the efficacy of the actual provision of the you know, the treatment in question. So does it actually help you with meditation? Does it actually help you control calories, etc.? So just a note of warning on those. Voice recognition and voice activated devices, again, probably a lot of you are already using these or at least know about them. So Alexa and Siri, these can be, again, be really helpful for health reminders, reminding you of appointments, and can be really helpful for people with limited mobility as well, rather than having to get up and do something. In the advent of, you know, the Internet of Things and them being able to connect with things around the home, this can be really helpful for people who maybe can't get up and about so much, and just have kind of these automated systems available. Telehealth, again, with the advent of COVID, many of you will probably be familiar with doing online appointments, which can obviously be helpful in terms of, you know, getting to and from surgeries and keeping infection control at bay. With digital health records, these can be passed much more easily between services. So rather than waiting, you know, weeks on end for notes to get passed to one consultant to another, you know, it happens fairly instantly, which moves kind of, you know, diagnostic processes on a lot faster. We also have the advent of digital wards, so where people need to be under a bit more constant monitoring, but perhaps don't need to be in a hospital. Their health can be managed remotely by a central point, so like a nurse practitioner or something, you know, which can keep people a bit more comfortable than being in a hospital. Communicating and networking. So again, with the advent of COVID, I think many of us appreciate how important these are for our social health. So things like video calling and social networks, where that physical social content isn't available to us. They really have some value in supporting us keeping social. And then there's some other more physical technologies. So like I picked out these friendship lamps. So you have one, a member of your friends or family have another. If you turn yours on, then theirs turns on too. It's just a nice way of kind of reducing that sense of isolation. And similarly with the digital photo frames, we have one of these for my grandparents actually, where we can send over pictures of the kids so that they kind of feel a little bit more involved in their lives where that physical contact isn't possible. And then moving on to digital intervention. So some of these we will have kind of talked a little bit around already, but more to do with kind of intervention provision, starting with text messaging. When GPs adopted text messaging for GP appointment reminders, the drop in missed appointments was really significant. So they have real value in terms of that reminder value. And they've also been used quite effectively in the realm of addiction and smoking cessation, just keeping kind of that conscious awareness of whatever health condition you're trying to kind of manage at the forefront of your mind. Then in terms of things like one-to-one therapy, obviously these can be done over video call, but we can also, there's also the potential of using artificial intelligence and machine learning at the start of the diagnostic process. So rather than using kind of human resources to think about, okay, well, what therapy is actually going to be best for a person at one particular time, there's a real potential for that to be taken up by artificial intelligence, leaving much more human resources to take care of the actual therapy part. Next, there's the potential for gamification of interventions. So some of you might have seen this in old people's homes. People were using Wii Fits to get old people more active and moving around with, some real good outcomes. And more this is being used to particularly in movement and physical therapy, gamifying it so that people are more likely to practice using particular limbs that they might have lost control of, to kind of rebuild muscle strength and stuff. And then moving on to online peer support, again, which can be really useful if physically there isn't anything in your area, or perhaps you don't have the ability to go out. And also it offers the possibility of anonymity as well, which some people really like, especially if they're seeking support in something which is a bit sensitive or maybe controversial. And on that note, I will pass you over to Hayley, who's going to take over talking about what we're doing at the moment. Hayley?
Thank you, Aimee. Yes, so just to give an example of a digital intervention in action, this is something that we've been working on for the last couple of years now, but we've only recently started a funded project around this. So the idea is to provide digital support for mental and sexual well-being after brain injury. And the intervention that we're working on has been developed with people living with brain injury, for people living with brain injury. So it's very, very person-centered. And what we've done is spent a few months now working with people living with brain injury to try and find out what are the mental and social and emotional needs that they have following a brain injury that might not necessarily be covered in a typical rehabilitation program or peer support afterwards. So that's where our idea has come from, and we're in the process of testing out our digital intervention at the moment, and then in a few months' time we're going to be opening it out into a trial. So we're really excited about that. In the trial phase, we're going to be testing out a self-directed version of the intervention versus a peer-supported version. So as Aimee said, sometimes people might not feel comfortable in a peer support environment when the topic is quite sensitive. So mental and sexual well-being are potentially quite contentious topics, and very sensitive and very personal. So we're just not sure at the moment whether a peer-supported approach would be appropriate for supporting this, these kind of well-being needs. So we're really excited to find out the results from that, to see, what people would prefer. So our program is based on positive psychology. So we are very much focused on positives rather than, the negative aspects of injury or illness, and kind of creating that upward spiral of positivity. And I think that's it. So we're really excited to be working on this, and it's just to give you an example of how we can kind of take some of these more traditional approaches of self-management and peer support and put them into a digital intervention that makes them more accessible.